Hello, doctors, and welcome back. Today we will be starting with the first topic for this new semester after we review all those words that you learned for the past semester. Okay, so today we're going to talk about something that is really, really important, uh, talking about children. And we're going to review three different articles just to see, talking about the disease control priorities in those developing countries. And we are going to talk about these acute respiratory infections in children. We're going to take a look also of this to this operational guideline for prevention and control of ARIS, or acute respiratory infection, in Afghanistan, and also take a look of this symptomatic treatment of this upper respiratory tract, which are the symptoms, signs and symptoms in children, basically. But how does ARIS impact our children? Why is it so important for us to talk about these acute respiratory infections? Well, it's only to know that about 20% of all deaths in children, which are under the age of 5 or 5 years old, are due to these acute lower respiratory infections, which we call ALRIs, which is basically pneumonia, bronchiolitis, and bronchitis. Okay, we are now aware of the World Health Organization estimates that over 2 million children under 5 die of pneumonia each year. And as we say, every year it kills an estimated of 1.4 million, accounting for 18% of all deaths of children under 5 years old worldwide. Of course, this proportion of these mild to severe diseases will be different between high and low income countries, and because of the difference in these specific etiologies and of course the risk factors, it will be really worse in those developing countries, all those countries which has low income, and of course this will result in a higher case fatality rate. Okay, so just to take a look at the difference, we know that during this neonatal period, as we can see in this part, okay, those neonatal preterm complications are the second cause of death, but mostly, as we can see, pneumonia is the in these areas are the most common causes of both illness and mortality in those children under 5. They have, in an average, 3 to 6 episodes of ARIS annually. And regardless of where they live or where their economic situation, we know that pneumonia is still the single largest cause of death in children worldwide. We can see these numbers, okay? Of course, what are those risk factors that we can face talking about these children? If we have low birth weight, we're malnourished and no breastfeeded children, and of course those who are living in those overcrowded conditions and those ones that are infected with HIV will be, of course, at a higher risk of getting pneumonia. We also know that people that deny to get the vaccine for their children for HIV and pneumococcus will be in a higher risk. If our children are vaccinated for these two, they have a best opportunity to prevent this morbidity and mortality of these acute upper respiratory infections and pneumonia. Of course, what is the most important fact of these ARIs is that we mothers will have an early recognition and prompt treatment for pneumonia. That will be the difference, and the prognosis will be always better. Okay, and well, ARIs or acute respiratory infections are generally mild in nature. It means most of them will be often caused by viruses and sometimes will be involve some bacterial components, and in some other cases we might find sinusitis and otitis media. We know that even though this medical care can mitigate both severity and fatality because of the mild nature of these ARIs, many severe low respiratory infections do not respond to the therapy. And most of the time will be because we have the lack of highly effective antiviral drugs. As we know, ARIs will not just confine to the respiratory tract, but they can also be involved in some systematic effects because of the possible extension or infection in the microbial toxins, because of the inflammation, and also because the reduced lung function. Okay, and well, let's talk about the classification of this acute respiratory infection. Depending on the site of the infection, we may have two different kinds or two classifications for these acute respiratory infections. The first one will be talking about the upper respiratory tract infections, what we call URIs, and that involves the nasal cavity, pharynx, and larynx. And on the other hand, we can talk about the lower respiratory tract infections, which we call LRIs, that involves the trachea, primary bronchi, and the lungs. There's also another classification that talks mostly the same, and we talk about acute upper respiratory infections, which are called AURI, and acute lower respiratory infections. Okay, and we can see the difference between the upper side of the infection, which basically talks about cough and cold and influenza-like illnesses, and the acute lower respiratory infections that talks about the SARI and pneumonia. Let's take a look of each one of them. Depending on the main organs that are affecting in the upper respiratory infections, we talk about the affection of nose, sinuses, middle ear, larynx, and pharynx, and we're talking about the upper part of the thorax. And the other classifications talk about the trachea, bronchi, and lungs, which are considered the acute lower respiratory infections. Again, talking about the upper respiratory tract, let's remember that it will consist or consider those airways, including those paranasal sinuses and the middle ear. As we remember, this upper respiratory tract includes the nose, the two nostrils, which are separated by a cartilage and a soft bone. And as we know, remember that the air enters to this upper respiratory tract through the nasal cavity, the mouth, and it goes from the nostril into the vocal cords and the larynx, and both of them are leading to the pharynx. We just also remember that while this air is getting into our body, it is warmed by the head and the capillaries present in the nose. It will dampen it when it passes over the mucus lining of the nose. It means it will get wet. It also will be using this cleaned cilia that will sweep dirt into the mucus. This cilia, which is called the vibrisas, and it will also helping us with filtering those hairs, the vibrisas, that will remove all those large particles. so the air will be as clean as possible getting into the lungs. Now, when we talk about the lower respiratory tract, we know this is the major focus of diagnostic respiratory cytopathology. Let's remember that it's being considered from the larynx into the trachea, and in this part we remember this tracheobronchial tree will be divided into progressively smaller units, starting from the bronchi, bronchioles, and the respiratory acini, which terminate in the alveoli. We must remember this is where the gas exchange occurs, and that's what makes it so important. Okay, mostly these acute respiratory infections of the upper and lower part can be categorized into common cold and cough and cold and influenza-like illnesses. Okay, we talk about this difference between what is a cold and a flu. We know the cold is the regular symptom for an upper respiratory infection, and we remember some of the signs and symptoms, and we might see the difference between the cold and the influenza. Okay, when we talk about the symptoms onset, it means when the infection begins to stroll in our body. We remember that when we talk about the cold, it's just gradual. It becomes just like 1 or 2 days onset, and the difference with the influenza, it is abrupt. As we remember, when we have a cold, it's very rare to have a fever, and when we talk about influenza, we know it's usual. All the H's, it means any pain on the muscles and the legs or arms. It's very slight in cold, but it's very usual in the influenza. Chills, it's very uncommon in cold, but very fairly common in influenza. Sometimes talking about fatigue and weakness, it's very unusual in cold, but very usual in the influenza. Sneezing, very common in the cold, but sometimes in influenza. Stuffy nose, very common in cold, but not really common in influenza. Sore throat, which is one of the most common symptoms that all patients will come to see us at the office. It's very common in cold, but sometimes or not really usual in influenza. The cough and chest discomfort, it's mild to moderate in cold, but when we talk about influenza, it's very common. And then finally, the headache, that is really common in influenza and really rare in cold. So these are the main difference between a cold and a flu. Again, we must remember that the common cold, cough, and cold, it's, as we said, acute onset of at least one times. The cough, we have sore throat, runny or blocked nose, and mostly we said is without fevers, okay? And then we clinicals will define if this illness is due to an infection, okay? We remember we have this runny nose, nasal congestion, sometimes the sore throat, and sometimes headache, okay? When we talk about influenza-like illness, then we remember it's an acute respiratory illness. The onset will be at least 7 days with a measured temperature equal or higher than 38 degrees and cough, okay? As we remember, we may have sore throat, dry cough, rhinitis, fever, chills, and headaches. Okay, when we talk about this overwhelming majority of ARIS deaths and these severe illness episodes, we know that now we're talking about those acute low respiratory infections, which consist mainly in pneumonia and those severe acute respiratory infections, which are known as SARI. Okay, these severe acute respiratory infections, we remember they have an onset, as we said, during the previous 7 days, and they sometimes will require overnight hospitalization because of the story of fever, which, as we said, will be equal or higher than 38 degrees, cough, shortness of breath. It means we have any difficulty breathing. The second one will be pneumonia, which along with the cough and the difficulty to breathe, we have the fever, chills, chest pain, and signs of breathing 50 or more times per minute in infants from 2 months to 1 year, and breathing 40 or more times per minute for children from 1 to 5 years, and no chest indrawing, stridor, or general danger signs. And then the difference for the severe pneumonia, we know these symptoms of cough or difficult breathing and any general danger sign of chest indrawing or stridor in a calm child. It is obvious then that pneumonia is the ultimate complications of most of the acute respiratory infections. We also have to think about that this recent increase of influenza-like illness falls under the acute upper respiratory infections are tending to be increasing the morbidity and mortality rates due to the acute upper respiratory infections, and its a consequence increases of pneumonia as well. At the same time, we know that newly in those last year, we are having emergency respiratory infections that are categorized into severe acute respiratory infections, or SARI, and that falls under these acute low respiratory infections and develops into severe pneumonia with high case fatality. The most recent example is this coronavirus as a result of this pandemic. Finally, we talk about this ultimately these acute respiratory infections has been one of constraint to reach the Millennium Development Goal 4 of reducing 2/3 of under the age of 5 years mortality by 2015. Okay, nowadays we know these millennium goals are really being a real challenge, not only for those countries that are fighting against this mortality in children under 5, but all those developing countries that has been suffering for this. The most important part of this challenge is for us as physicians and healthcare people to teach our women or mothers to be aware of those warning signs of these ARIs. It's very important for us to keep up trying and also keep teaching those warning signs and symptoms. Okay, doctors, so this is just a small review of these ARIs, these acute respiratory infections. The most important part of this is to understand the classification, whether it is an upper respiratory infection or is a low respiratory infection, because that will be something that will give us the prognosis for these children. Okay, we will see you in Zoom so we can make our quiz for these warning signs in acute respiratory infections. Thank you.